Assalamu alaikum. I'm here to present sodium nitroprusside with my group member Mariam Asif, Zara Ali, Sara Ali, and Nagina Ayub. Introduction. Nitroprusside is a direct-acting vasodilator used to treat hypertension, to induce controlled hypertension, to reduce post-operative bleeding, and to manage acute heart failure. Its brand names are Nipride, Nitropruss, and generic name is Nitroprusside. Background. Nitroprusside serves as a source of nitric oxide, a potent peripheral vasodilator that affects both arterioles and venules. When used more than arterioles, nitroprusside is often administered intravenously to patients who are experiencing a hypertensive emergency. Chemical structure. Nitroprusside is an inorganic compound with the chemical formula it written over here, usually encountered as a dihydrate, and it contains 5 cyanide group and 1 nitric group. Properties. Absorption. 0% oral availability, degraded into cyanide almost immediately on contact with mucosal surface, and route of administration is always IV. Solubility. Its solubility means its pH value is minus 3.3 below 0, which means it is highly water soluble. Pharmacokinetics. When we take nitroprusside, they enter into the bloodstream and make a complex with oxyhemoglobin like methemoglobin and cyanide and nitric oxide. Nitric oxide further perform its action, but we are talking about pharmacokinetics in which methemoglobin and cyanide enter the liver and form cyanomethemoglobin, and in liver cyanide react with thiosulfate cobalamin and form thiocyanate. Thiocyanate is then excreted out from the kidney, and sometimes cyanide also enter tissue cytochrome oxidase, react with tissue cytochrome oxidase in tissues and cause cyanide toxicity. Pharmacodynamics. Nitroprusside, a powerful vasodilator, relaxes the vascular smooth muscle and produces consequent dilation of peripheral arteries and veins. Other smooth muscles like some uterus and duodenum are not affected. Sodium nitroprusside is more active on veins than on arteries. Mechanism of action. Act as a donor of nitric oxide. Nitroprusside act as a donor of nitric oxide, which activates guanylate cyclase, resulting in an increase of guanosine 3,5 monophosphate, means cyclic GMP. In vascular smooth muscle, this hyperpolarizes the membrane by increasing potassium channel conductivity and decreases the availability of intracellular calcium. All these activity cause the decreasing the resting tone and contractility of vascular smooth muscle and causes relaxation. Here is a video in which we will learn about his whole mechanism. We have a myosin light chain kinase enzyme, which is converted into myosin light chain kinase active form, which react on myosin light chain and form phosphates, myosin light chain phosphates, and myosin light phosphate chains. They produce phosphorylation on the myosin light chain. Phosphates can be formed. Now, in this phosphate form, MLC can bind with the actin so that it can produce actomyosin complex. This produces a contraction of vascular smooth muscles. Sodium nitroprusside can enter vascular smooth muscle where it is going to release the nitric oxide. Now, this nitric oxide can stimulate the guanyl cyclase system, which converts GTP into one of the important secondary messenger cGMP. Then cGMP can produce a phosphorylation of MLCK such that it is converted into MLCK phosphate, which is the inactive form of this enzyme. Similarly, it can also inhibit the activation of MLCK. By these two actions, it can inhibit the contraction of vascular smooth muscles, and it can also inhibit the the entry of calcium. So by all these actions, sodium nitroprusside produce relaxation of vascular smooth muscles, and this reduces the blood pressure. That's why this drug is indicated in the conditions of hypertensive crisis. The next is Clinical effects.
Clinical effects. Here are some clinical effects of the sodium nitroprusside. Sodium nitroprusside has been used in clinical practice as an arterial and venous vasodilator for 40 years. The first of all is the systemic vasodilation, balanced vasodilation, and arterial dilation. It also reduces preload as well as reduce afterload, increase the intracranial pressure, headache, reflex tachycardia, and methemoglobin. The second one is the tolerance. Tolerance develops over sustained use, that is the tachyphylaxis. Significant cyanide toxicity can occur with doses in excess of 2 mg, 2 mcg per kilogram per minute. Adverse effect. Here are some adverse effects of the sodium nitroprusside. The first one is the cardiovascular, which causes bradycardia and tachycardia. It is the slower than normal heart rate. The second one is the central nervous system, which included headache and dizziness. The third one is the dermatologic effect, which include diaphoresis and skin rashes. Fifth one is the endocrine metabolic, which included hypothyroidism. The fifth one is the gastrointestinal, in which included abdominal pain and nausea. The sixth one is the hematologic oncologic, which decrease platelet aggregation. The seventh one is the musculoskeletal, which included the muscles twitching. The contraindications of the sodium nitroprusside. It occur the acute hypertensive crisis, acute decompensated heart failure, induction of perioperative hypertension to reduce blood loss, acute heart failure with low systemic vascular resistance, for example, septic shock, Leber's hereditary optic atrophy, tobacco amblyopia, vitamin B12 deficiency are associated disease states.
Now let's talk about the toxicity of nitroprusside. Toxicity of nitroprusside is related to its potent antihypertensive effects and the accumulation of toxic metabolites like cyanide, thiocyanide, and methemoglobin. Cyanide toxicity. Cyanide toxicity is basically related to the nitroprusside by in which hemoglobin is subsequently metabolized to 5 cyanide ion and methemoglobin. Cyanide then convert to thiocyanide and that causes a very symptoms and toxic effect in the human. And then let's talk about the hypotension. Hypotension is profound to cause toxicity when in the compromised or the failure of the vital organs. Thiocyanide toxicity again causes various effects in the human body like weakness, pain, agitation, disorientation, lethargy, seizures. All these are related to the thiocyanide toxicity. Methemoglobinemia. Methemoglobinemia most often occurs in the patient receiving the infusion of the nitroprusside that is greater than 10 microgram per ml, while symptoms of serious toxicity are expected when serum level is greater than 100 microgram per ml. Then increase intracranial pressure. Increase intracranial pressure is also the result of cerebral vasodilation. Now, what is the dosing? In the hypertensive crisis, infusion rate is zero point 0.3 microgram per kg per minute. This value may be decreased or may be increased in the case of the weight of the patient. And this is mainly given to evaluate the blood pressure for at least 5 minutes before titrating to a higher or a lower dose to achieve desired BP. Then acute heart failure.
Nitroprusside is also given in the acute heart failure. Initial infusion rate is 0.3 microgram per kg per minute. This dose is also managed according to the age and the weight of the patients to increase and decrease the desired blood pressure. Dosing consideration not to be exceed than 10 microgram per kg per minute. Continuous blood pressure monitoring is also required during the infusion of the nitroprusside as it is very toxic. Uh, Thanks for your attention.